Okay, we'll get started. So good evening, everyone, and welcome to tonight's webinar on Macquarie's Master of Public Health. So my name is Luke, and I'm a student ambassador for the university. I'm going to help out moderating tonight's webinar. So before we begin tonight, I would like to acknowledge the traditional owners and custodians of country throughout Australia and their continuing connection to land, waters, and community. We pay our respect to them and their culture and elders past, present, and future. So today's session is going to give you a little snapshot on the Master of Public Health at Macquarie. It's going to showcase a bit about the career options, about exploring future opportunities that you may have and pathways to various career trajectories. So how the webinar is going to work tonight in terms of structure. First, you're going to hear a bit more broadly about Macquarie's Master of Public Health so that you have a good overview of the course. And then you'll also hear from an alumni of Macquarie's Master of Public Health and a bit about how they've applied their studies into their career. And then this will be followed by a Q&A session with all our live attendees. So as a bit of housekeeping before I introduce both of our speakers, if you do have any questions throughout either of their presentations, you can always put it in the Q&A chat at the bottom of your screens, and then we'll get to it during the Q&A component. This session is being recorded, so if you need to watch it again or there's anything that you might have missed, it will be sent to you, so yeah, you have that in mind. And if we do run out of time and we don't get to answer all your questions, you do have the opportunity to book a one-on-one personalized consultation with the Future Students team. And I'll put a link into that a bit later in the webinar. So today we are lucky to be joined by two speakers. So firstly, the Professor Janeki Amin, who's the course director of the Masters of Public Health at Macquarie and the head of the Department of Health Systems and Populations. And we also have Ashlee Gardner, who is a Macquarie alumni. She is currently the Health Promotion Project Officer at the Western Sydney Local Health District. So to get us started, I'll just pass it over to Janeki.
Hi, thanks, Luke. Welcome to our session tonight, and hopefully we'll provide some information for you that will encourage you to study public health and public health at Macquarie University. A little bit about me. So as Luke said, my name is Janeki Amin. I'm the course director of the Master of Public Health here at Macquarie University. So the Macquarie Public Health Masters started in 2017, which is when I came to Macquarie. Prior to that, I've been a researcher in immunisation research, and I spent a long time researching HIV and hepatitis C treatment and prevention strategies, and that's my primary area of research, and I still work in that field. But coming to Macquarie University, my primary role has been designing and rolling out the Masters of Public Health course. And this being a new course has allowed us to create a degree that is really fresh and new. All the curriculum is current for the world in which we live in today. And being new, it means that we're very flexible as well. And as all of you, I'm sure, are very well aware, public health has become the forefront of most people's activities and lives at the moment. Public health has always been something that we're all impacted all impacted by, but at the moment it's very obvious what those impacts are. So as a public health practitioner, we're really driven by ensuring that we have a skills-based program so that everyone who is graduated from our program, we can be assured has the skills required to work in public health practice and or research. We have an authentic curriculum, which means that we've spoken to people who work in the public health workforce and in research, and we discuss with them what skills they expect Masters of Public Health graduates to have. And we design our course to ensure that those skills are built into the course so that when you go into the workforce, you feel confident and comfortable that you can actually do the roles that have been intended for you to do. It also means that we have a diversity of assessment types that speak to all the diversity of roles you could have in public health. This gives you the opportunity to explore different aspects of public health, and it means that you can figure out which things appeal to you, what you'd like to work harder in, things that you may not like but you need to figure out what they are, but also what you feel really passionate about. And as I go through this presentation, you'll see that there's so many options within public health. One of the key features of the Macquarie Public Health degree is that it's interdisciplinary. Public health is always interdisciplinary, but we enable that type of teaching by working very strongly with the faculties across the university to ensure that we have people with expertise to teach you the courses that are included in this degree. We also have structured the course so that you can be assured that you're getting the fundamentals first. So that's the teaching that happens in our core unit. It's aligned with the expectations of all schools of public health in Australia, and it also aligns with accreditation requirements in Europe and in America. So the core units are foundations in public health. That speaks particularly to people who haven't had any public health exposure before, or refreshes people's understanding of what public health is. Epidemiology and statistics, which is often considered the core of public health. It's where we learn about much of the stuff that you will have heard about on the news of late. So epidemiologists are having their moment in the sun, thinking about how diseases spread and how populations are affected and how we count the numbers. So that's what the epidemiology and statistics unit looks at, as well as understanding how to interpret evidence. So as I'm sure you've been aware, we've had so much information coming to us around the COVID epidemic, and being able to sift out what is meaningful information and discarding the rest. So that's really critical as part of epidemiology, is understanding what is good data and what is rubbish data. Not all data is the same. The determinants of health. So what are the characteristics, whether they be policy or innate or social or environmental, that impact on our ability to live healthy lives? And we look at health, law and economics and their roles in creating health systems, looking at ways of promoting health, and Ashlee will be able to talk to us about a bit more about that. That's the field in which she's working at the moment. And health systems, so how things come together, how the government plays a role in creating a health system that supports the health of populations. And then in the elective space, we have units that are run from within the department. So they're the black and the red units that are listed on that slide, and interfaculty units. I haven't listed all of them, but the areas in which our interfaculty relationship works are around global health, leadership and environmental health. So you can see there's a diversity of elective choices there, and people can choose their areas in the elective space. Now, the Macquarie Masters of Public Health is a 2-year degree. In the first year of your degree, you'll study all the core units, and you may have some options about electives. It depends on your course structure, how many electives you do. So if you choose, you can do a whole 2 years of coursework, in which case you'll do the core in the first year and you'll do a large series of electives in the second year. Your 2 other options for the second year are to do a research year or to join the professional practice pathway. So in the research year, if you decide to take that pathway, you get the opportunity to do a full year of research. Now, that's one of the most comprehensive research opportunities for a Masters of Public Health in Australia. The entry for that pathway is selective, so you have to perform well in your first year. And that is to ensure that you have the skills that will support you in getting through the research year. It also means if you successfully complete that year, it means you're eligible for a pathway into a PhD program if you have fallen in love with research, which I hope some of you will. Currently, we have students who are supervised within the department, that's Health Systems and Populations, people who are studying in biomedical sciences, and we have very close alliance with Macquarie Hospital, which is the hospital on the campus of Macquarie University, as well as AIHI, which is the Australian Institute of Health Innovation, who are also located in Macquarie University. And both of those organisations support our research students and currently have students enrolled in the MPH research year with them. We also have external organisations like the Red Cross who are partners in this research pathway. So they also support the research endeavour. So you can see it's a very collaborative type of space in which we do research, and we have experts who are embedded in research who do the supervision for that year of study. The third option is the professional practice stream. So within this, you do a 4-unit of study option in professional practice, which means that you're embedded in a workplace internship effectively for a whole semester full time. So that's 35 hours a week across 10 weeks of the session. You can take this option in session 1 or in session 2. It's one of the most intensive placement options in Australia. So to do full-time work in a space that is a public health space is a great opportunity, we feel. And we have a number of places that you can go to do that placement option. So including, as I said before, AIHI, which is the Australian Institute of Health Innovation, Macquarie Hospital. Also, the Public Health Network in North Sydney have taken quite a few of our students, Western Sydney Public Health Unit and LHD, the local health district at Western Sydney. Drug and Alcohol Centre at New South Wales and the Cancer Council. That's just a few of our placements. And if there's a place that you're particularly interested in, then we can also look at partnering with them. So the professional practice stream also has a competitive entry process. So you have to perform well in your first year to be able to go into the professionals practice stream. And you also go through an interview process, and part of the rationale for that is to give you some real world experience about applying for a job. So you go through and you have to create an application as well as go through an interview process for that professional practice stream. So that's the general overview of the Master of Public Health. It's a 2-year course with a common core for the 3 options. So that first year is your core units. And in the second year, you have the option of either doing coursework, of doing research, or doing a half year of placement plus a half year of coursework. So that's the overview of the structure of the course. Now, we've found that students exiting the course have performed really well. Almost all of our research students have either pursued careers in research or have found work. And our professional practice students have also had really great success in transitioning from work at their placement to being selected for jobs in those placements. So not everyone gets the opportunity to have ongoing work at their placement, but we certainly have some who have done this. And Ashlee Gardner is one of those people. So I will introduce you to Ashlee. Hi, Ashlee, who is one of our alumni, an MPH student who went on to a placement at Western Sydney Local Health District. And Ashlee, I'll hand over to you. Tell us what happened after that.
Thanks, Janaki. So, hi everyone, I'm Ashlee. I graduated the MPH last year. And at the start of last year, I did a placement with the tobacco control team at Western Sydney Local Health District. And after my placement, I was actually offered a job not in the tobacco control team, but in the healthy eating, active living team. So that's where I'm working now. And so I think I'll just give you a brief maybe overview of what my role is, and then maybe I'll chat a little bit about the MPH and my experience. So as was mentioned, I'm a health promotion project officer. Health promotion is a bit of a niche field, which is really exciting, and I would encourage you to investigate it if you don't know what it is. But it's basically a combination of health education and creating environmental change. So if you've ever seen the Ottawa Charter, that is our go-to document. That's basically health promotion in a nutshell. And so that's what we do every day. So my work specifically is focusing on healthy eating and active living for adults in Western Sydney. So looking at the food environments which people live in, the physical activity environments, green spaces and open spaces, as well as making sure that people have the skills and resources to live a healthy life. So my day-to-day is different every day, and I'm sure you've heard that from everyone who talks about their job, but truly every day is different. There'll be some days where I could be at my desk all day reading literature, writing project plans, doing evaluations and data analysis. And there's other days where I'm out in the community all day, doing site visits at hospitals, doing retail audits. And this year we've had the opportunity to be involved in the COVID response as well. So health promotion is really vast, as is public health. And so I definitely would encourage you to have a look at all the streams of public health and see what really does interest you. So that's kind of my job now and where the MPH has led me. But I guess I can probably go back in time to let you know why I picked the MPH and why Macquarie in particular. So for me, the MPH was kind of the choice of all of the health masters that I could do, just because it gave me so many opportunities to have a look at all of the streams of health and really build the skills that I would need to work in so many fields. So the MPH will build skills and provides those opportunities to work in areas. Obviously, health promotion is where I chose, but you could work in environmental health, you could work in infectious disease, you can work in epidemiology, and you can work in research. So that's just a couple of the ones that sit in my unit, for example, but there's so many avenues that you can go with an MPH. So really would encourage you to consider an MPH as your master's degree, because it really will give you so many opportunities. I guess I chose Macquarie in particular because, as Janaki mentioned, it is a brand new course. When I enrolled, there had only been 2 cohorts go through the MPH. And so I knew that all of the content would be really, really new and really relevant. Nothing would be outdated because it was all brand new and just written. So I think for me, I was really confident that everything that I would be learning would be applicable in the field. And that's absolutely what I found going through the MPH. Everything that you learn, you take out into your career later on. So Macquarie is definitely a place to study, and all of your lecturers that you come in contact with are not only experts in the field, but they work in the field. So with the COVID response, for example, we got in contact with Janaki to get some help with our communications. I'm on a committee called the Right to Food Coalition, and the health promotion lecturer Ramante is actually involved in that group as well. So, you know, the people who are teaching you these skills are out there using these skills every day. So you'll definitely be learning things that are so relevant to the work that you'll be doing eventually. So yeah, definitely Macquarie was my choice. There was no question. I didn't really consider other universities once I'd seen what the course at Macquarie was like. So I definitely recommend you consider Macquarie and the MPH. So I guess I talked a lot about these kind of skills that you learn, and they stay with you, and that's so true. I think, I don't know if it was just me, but in my bachelor's degree, I was learning so much theory, and I always wondered when I would ever use the theory that I was learning. But with this MPH, everything that you learn, you take out and you will learn use in your career. So for example, those core units that Janaki mentioned, the foundations of public health, you learn about the social determinants, you'll learn about that Ottawa Charter, you learn in epidemiology about data collection and those kind of methods. And they're things that I use every single day. And so everything that you learn in the course is absolutely so relevant and will set you up for a career. And even if you've never had any job experience, you can use those skills and the courses that you studied in job applications to show that you know about these things. Because while on-the-job experience is important, the things that you learn at university are absolutely relevant to the field, and you can use those to show that you do have experience there. So everything that you learn in the MPH is going to be useful in the field. So definitely think about the units that you are studying and maybe where you might want to go. So that's kind of my experience with the MPH. I might just leave you with a little bit of advice. I've probably not been out of the MPH for very long, but I have been in this role for over a year now. So I think I have a little bit of insight into the way the MPH works. So I think the key thing that I guess took away from the MPH is public health is so broad. There are so many ways you can go with public health, but it's important to work out where you want to be. So the core units will give you a really broad idea of the different things that you could do, and really pay attention to where you think you might sit in those streams, because once you get the opportunity to do elective units or to do research, you can really hone in on that interest area. So when it does come time to applying for jobs or putting things in your job application, you have those relevant skills to that area that you're interested in. So yeah, it'll just make the MPH so much more fun for you. And it might sound strange, but uni actually was really fun and I really enjoyed it. So I would recommend picking units that you are interested in and you think might be relevant for your future career. And I guess the final thing that I might say is use this opportunity not just to learn skills, but to build your social network. So as I mentioned, lecturers that were teaching me are now my colleagues. The people that you're studying with will be your colleagues in the not too distant future after you graduate. So really use this time to make connections, because you never know when you'll need a hand in your career later on. So yeah, that's my, I guess my summary of my time in the MPH. It was great. I wouldn't trade it for anything. So yeah, I might pass back to Luke now for Q&A. Oh, I think Luke's having some video issues. Oh.
Apologies there. We're all getting still used to technology in this COVID era. But yeah, thank you there, Ashlee, for your insights, and thank you, Janeki. But it was particularly good to hear from you, Ashlee, as an alumni of the course, because we have lots of students coming in and they seem quite interested in it, especially hearing from someone who's recently completed it. So that's great to hear. And we'll start to jump into the Q&A components of this evening. So remember, if you do have any questions, you can always put it in that Q&A function at the bottom of your screens. We've had a question here about, for yourself, Ashlee, about what type of support services are available to students. Now, you mentioned that university was fun, so maybe get a bit to hear about some of the things that Macquarie offers its students, and maybe some of those less formal ways that you've been able to interact with other students.
Yeah, so definitely. Obviously, the Macquarie, there's a lot of support built into the formal structures of Macquarie University. There's a lot of opportunities to access mentoring and things like that. But I guess informally, because the MPH is such a small cohort and will probably be even smaller potentially without international students in this next intake, you really get to know the students around you. So, you know, it's so easy just to go to anyone and get some support, ask for advice. Everyone's so friendly and lovely. There's discussion boards on iLearn where you can just pop up your question and someone will definitely answer it. Obviously, you've got your tutors, you've got your lecturers that are always a great resource. And because the course is so small, they always have time for you. So, you know, aside from accessing formal support through Macquarie, you know, you've got the library support and things like that as well. But definitely the MPH is such a supportive course. And I think that's built into the culture of the course as well. With your lecturers and your tutors, just they want the best for you. So they definitely will support you in any way that you need. So just ask, absolutely.
Maybe, Janeki, you can illustrate on the other side what that is like for lecturers in the course.
So we very much treat students as part of our community rather than being a one-way delivery of information. We treat our students as our colleagues as well in some instances, but and remembering that people come from a diversity of backgrounds. So from people who have had no health background, who had some undergraduate training, to have worked in the public health workforce. So we have a really broad range of people who are in the course. So we really love engaging with people's experiences and ask them to share those experiences in the class so that we have a shared learning environment. I pick up things from students all the time, whether it's their personal experiences or just their perspective on something that we haven't heard before. So you'll find that you're asked to share your experience a lot in the MPH course, whether it's directly in class or through assignments or through reflective journals. We very much have a collaborative arrangement around that. And in terms of support for students, like Ashlee mentioned, we have the unit conveners who are always accessible to students, who are very much encouraged to have an engagement with your unit conveners. I'm the course director, so there's always space to come to me if you need that as well. And as Ashlee mentioned as well, we have space across the university for additional skills development, whether that be within the library or numeracy centres, campus wellbeing. There's a lot of spaces for support for students.
Mm-hmm. And this has all continued throughout COVID-19. It's not face-to-face physically, it's still available online.
Yeah, it certainly is. There is a lot of there's a lot of communication that's been happening during COVID in terms of online chat. So we have a learning system that allows people to post questions. Your lecturers can be available by email, and as is the new world for most of us, Zoom is now part of our daily lives, and students have really found that helpful. So quite different to what people used to do with online learning, where they may never see their unit convener. People have really engaged with this space of Zoom, that you can interact in a way that's different to what people previously thought of as online learning. You can still be very interactive and engaged and get to know people through
That's really great to hear. Yeah. Thanks, Janeki, on that. Another question, and you kind of touched on it a bit before, but if, say, someone's thinking about doing the Masters of Public Health and they don't have a background in health, would it be difficult for them to enter into the industry?
So like we said before, public health is a really broad area of endeavour. We have people in the course who have got health backgrounds, and as I was saying, the nice thing about that is that they share their knowledge as well. But we also have people from a diversity of other backgrounds. So we have people who have been journalists, we have people who've come from other allied health areas, from departments of planning, so people who are interested in building spaces. Yes, so you don't have to have a health background. You certainly have to have an interest in people's health, but we do come from a space where it's adult learning and it's postgraduate, so you are expected to engage in the content yourself. We do expect you to be keen and invested in learning, but we give you all the materials to get you up to speed on the content that's delivered as well.
Mm-hmm. Great to hear. I hope that answers your question. A question for you, Ashlee, based on not sure when you discovered or when you realized that public health was where you want to be, but say a student is still a bit unsure whether they want this to be their direct career goal. How would you give them, or what advice would you give them to tell them to explore their options further, to figure out if public health is for them?
Absolutely. So, I mean, the great thing about public health is that there are so many avenues. And I guess it's hard to tell what people's perception of public health is, but I didn't really learn the breadth of public health until I started working in the field. So if you're interested in health in any way that's not nursing, public health is a great degree for you, because you've got opportunities to look into research, you've got opportunities to do epidemiology and data collection, you've got opportunities for environmental health, health planning, health economics, health law. So if there's anything health related that interests you, the first year of the MPH will give you that full breadth to help you kind of decide what direction you want to go. So I guess public health as a specialty isn't really locked into one direction. So, you know, take the first year of the MPH, see what interests you, and then use that second year to really direct, I guess, your learning to whatever it is that interests you, whether that be health economics, health law, I guess traditional public health and epidemiology, whatever it might be. But I think you can not know what you want to do and still enter the MPH and find your pathway within the degree.
Mm-hmm.
So I'll just add to that a little bit. If you don't actually know whether public health is what you want to do, I think have a look at the course outlines which are available to you, and look at various universities, different places, and you'll get a sense of what is essentially public health, what the core components are, and see if they speak to you. I think the relevance of public health has become evident to everybody at the moment. Whether it speaks to you in terms of a discipline of learning, I think have a look at the units and see if there is something in all of that does appeal to you. As with all degrees, there's some things that you may have to do that's not particularly what you want to do, but there should be a sufficient amount of content that is of interest to you and that you'd be keen to engage with.
Mm-hmm. Thanks for that input there, Janeki. We've had another question come through, and someone who seems very interested in health, but they don't think the government or public hospitals is where they can see themselves. So maybe Ashlee, if you can think about any other places where you can apply this Master of Public Health.
Yeah, so as we mentioned, public health is super broad, and one of, I guess, our biggest partners is non-government organisations. So that's kind of a cluster term, and there's a whole number of organisations that you could work with that are non-government, whether that be things like Cancer Council or Heart Foundation, which focus on specific health conditions, or councils, for example, who are looking at open space and town planning and things like that. So basically, yeah, that any organisation that has a health focus or not, council have, I guess, social planning teams, but not necessarily health teams. But yeah, there's definitely so many organisations outside of government and public hospitals that you can definitely get involved in. And I think when people think of government, so I work for New South Wales Health, but I don't work in a public hospital, and I kind of don't feel like I align with working with government because I sit outside the hospitals and I work with the community. So there's a lot kind of in that as well, working for New South Wales Health, but doing things like environmental health or infectious disease control, which, you know, maybe don't kind of align with the traditional idea of what health is. And there's also, you know, you've got research organizations, you've got universities that you could work with. So there's a whole number of things. And I guess that depends on, I guess, your focus area or the stream of public health that interests you the most. So yeah, if there's a particular stream, I think I could come up with some specific areas, but yeah, there's a whole range of organizations you can work with.
They might come through on that later and where's their specific interest, but I think that really labels how broad it is, especially in this day and age. A question for you, Janeki, about Macquarie's program specifically against other institutions, and maybe you can illustrate what makes Macquarie so unique, and maybe talk a bit about Macquarie's hospital, if it plays any part.
Sure. So as Ashlee mentioned as well, I think being a new course is really something that makes us different to some of the other courses that are going in the other universities at the moment. So when we designed the course, it really did emphasize the key skills that are needed in today's environment, and just adding on to some of the of what Ashlee said of the workplaces you can go into. So we have some electives that are very much around information technology, which is another key area of where public health is working. There's lots of tech companies that are looking at public health applications for their work and digital health. And the private sector has also got interests in public health, from insurance companies like Bupa to finance companies like KPMG. So they all have public health sections within their, or public health related sections within their roles now. So we look to organisations like that and to examine what sort of skills bases they're looking, what are the key skills that they need for practitioners who are going to work there. And because we're new, we're able to engage in that space. The other thing is, like I said, the Macquarie Public Health gives you is that 1 year full embedded research experience, which is also quite novel. Most MPH programs don't provide a full year of research. They might have 6-month components or half session components in research. And if you really want to test your hand to see if research is something for you, it takes a little bit of time to build up those skills to really see any outputs from that. So we feel a year gives you that competency, and it also gives you the eligibility for PhD if that is what you want to do. And then the professional practice is really novel for MPH programs as well. Again, other public health courses may have some work placement, but this is one of the very few that does a 6-month, 10-week embedded placement. And what that gives you is you're not just doing photocopying or listening to seminars, you actually get to do work in the workplace, which means that our partners are really happy because it gives them something back as well as giving something to you. So this builds on our community of practice. And that's something you'll see from the Macquarie Public Health, that we're very much a values-based course. It's not just about competencies, it's about a way of thinking and a way of engagement, and being collaborative and using that co-design sort of approach is really integral to what we do. And I think that is quite distinctive for an MPH program.
Great, that's great to hear. That's really comprehensive to hear about all those benefits for the Macquarie's MPH. We've got a question here for you, Ashlee. You talked a bit about your current role, but maybe you can help talk about what is the average working day for you? How is it looking, and maybe how you're applying those ways of thinking in the MPH?
Yeah, so every day is actually different. I know you hear that a lot, but I promise you it's different. This year has definitely been impacted by COVID. So I sit with the public health unit. We're all part of the Centre of Population Health. So this year I spent a lot of time in the COVID call centre, which was brand new and definitely an experience for the health promotion team, branching out into that public health space again that I haven't really touched since the MPH. That was exciting. So I guess for me, I have kind of days in the office where I spend a lot of time writing project plans. So all that writing, every essay you do definitely comes in handy. You'll use it once you graduate when you've got to write things. So, you know, writing project plans, writing briefs to the executive to get their support for projects, doing data analysis. So biostats and epidemiology comes in handy. So there'll be a lot of office days, a lot of those kind of planning days. And you kind of get a sense of that in the health promotion unit that you will do, of kind of what my planning experience is like. You get to design your own project in that unit. So I do a lot of that, but I also have days where I'm on the road. I might do site visits to hospitals. A lot of my projects involve midwives and new babies. So I'm, you know, visiting midwives in clinics. And so all the people skills and the leadership skills that you learn, you really have to apply with clinicians to get them to listen to you, because they are so busy. So you've got to get your point across really easily. And then, you know, there's days where you're out in the community. You might be doing, I do a lot of audits at hospitals. So really anything you could possibly think of, we're involved in somehow. But all of the things that you pick up, whether it be theory skills that you learn in the content or just the people skills and the leadership that you get from those. There's some units about leadership as well. Those kind of skills you will definitely be using them in the workforce. So yeah, definitely every day is different in public health. Yeah, it's great. It's so much fun. That's why it makes it exciting.
Keeps you busy.
Absolutely.
All right, that's great to hear. I think we'll have another question about Macquarie's MPH more specifically for you, Janeki, about the application process. And maybe you can talk a bit more about what does it consist of and what makes someone more likely to be successful in their application.
So the general entry into the MPH program. Okay, so the application process is quite straightforward. So if you're interested in applying, you can go through the website, through the course finder for Macquarie University. And there's also some chat information. You can join a chat group there about application. So if you have got a discipline that's related to public health, then the entry pathway is straightforward. As once you've finished your degree, you can be eligible for entry into the MPH program. If you have finished your degree a little while ago and you're working in a public health area workforce, you might even be eligible for a reduction in the time of the course. So looking at recognition of prior learning. That comes into play as well if you've got any other postgraduate studies that are related to public health. So you might be decreasing your course requirements by about half a year. That process, if you want to go through the RPL process, then you need to provide additional information about other courses that you've taken that you think are relevant. But the requirements for the course are very broad, so you can come into the course without having health training prior to entry into the MPH program. You have to have finished your bachelor's degree. And the more specific requirements you'll find on the website. It's quite straightforward, and we'd love to have you. I think somebody asked specifically about the transition to the professional practice year and the research year. So the professional practice, you need to get about a credit average in first year. And for the research year, you need to have a credit average with a distinction in the epidemiology or research methods units.
Mm-hmm. Yeah. And maybe to get Ashlee's perspective, considering that Macquarie offers it as a 2-year course, how did you find having that extra year to kind of solidify what you're being taught? How did that kind of benefit you as a student?
Yeah, so I mean, that first year is kind of your core units, you're finding your feet, working out where, I guess, your interests are. And that second year really gives you, I guess, time and space to explore your interests. And so that second year I did placement in the first semester, and then my second semester I did a whole range of electives that were kind of relevant to health promotion because that's where I wanted to go. And so I think the 2 years kind of really complement each other really well. Your first year, you're kind of learning the whole breadth, and then that second year, for me at least, if I kind of used it to really hone in on that area that I was interested in. But I guess it's up to you what you do with that second year as well. You could go really broad and take electives from everywhere and really kind of, I guess, give yourself a whole range of skills if you're still not really sure where you want to go. Or you just go really specific, pick those units that you know will lead to a particular career path. So I think it's a great structure to have that kind of 2 years to complement each other.
So we also do have students who enroll having gotten the discount on their time, and they ask for a reversal of their RPL because they want to actually explore more options or do the research or professional practice. So we don't have many complaints about it, the 2-year course, considering the additional elements that we offer in that space. So.
That's great to hear. Thanks for that, Ashlee and Janeki. Also had a question, maybe Janeki, just quickly on what is the class profile? So what kind of students can other Masters of Public Health students expect to have in the classroom?
So like I said before, it's quite diverse. We have people who have come straight from undergraduate, people who have come through other professional degrees and worked for a while and found that they want to either diversify into a different workspace or work in public health within their own profession. So often nurses, so we have quite a lot of nurses, doctors, dentists and physiotherapists and OTs who come into the course. Some of them are looking for public health works in all of those fields as well. So sometimes they're trying to apply public health into those fields, or they're trying to shift profession. We have lots of undergraduate students who have come through various degrees. So Bachelor of Human Science, Bachelor of Science, psychology degrees, social science degrees, who have sort of broad understanding and have come to the end of their degree, and they still feel like they want something a bit more defined and that has more of a pathway into practice and professionalism. So the Masters of Public Health builds on their undergraduate knowledge and gives them a pathway to apply a lot of those skills. And then we have people who have come from diverse backgrounds, so maybe not health at all, like I was saying. We have some journalism and architecture, and that's not coming to me what else we have, but we do have quite people from all sorts of areas. And then we've had people who are quite senior who come into the course as well, who have had long careers in other spaces and are looking for a change, or they're just doing the MPH because it interests them. It's impacting on a lot of people, and it gives them a deeper level of understanding of how public health works and impacts. And there's some of the great students in the class because they share lots of lived experience as well. We have traditionally had a lot of international students, many of whom have stayed on through all of this and will still be around next year, and they provide a lot of insight into diversity of how public health is delivered across lots of countries and a lived experience of that. And we have domestic students who provide experience around what's happening in our communities currently, and they can find that really fulfilling, having that diversity of people in the room. It is a multidisciplinary course, and it attracts people from all sorts of walks of life. And I find that diversity is really a lot of what I enjoy in teaching the course as well.
Ashlee, did you enjoy having that type of diversity and getting to interact with your classmates?
Yeah, absolutely. I think having that diversity means, you know, in discussion, everyone's got a different perspective and a different understanding of certain things. And I think, I guess everyone's lived experience and I guess study experience is what I guess made our discussion so fruitful. And I think everyone, I guess, helped each other learn certain things. You know, domestic students, we understood the healthcare system in Australia a little bit better. So we were kind of filling in the gaps there. And, you know, international students could provide, I guess, another perspective about what happens around the world. So I think having that diversity really made our discussion so much more interesting and I guess opened our eyes to maybe what's happening outside of our little bubble. So yeah, definitely really interesting cohort when you've got a different group of people.
Great. That's great to hear. Yeah. We've got a few more specific questions because it seems like lots of people are committed now to the Masters of Public Health, but now they're just wondering if they can go into their set area that they're very intrigued by. So let's say for aged care or child care, maybe Janeki first, maybe Ashlee, if you'd like to tag along on a few points in this, but how would someone go about that? If that was their point of interest, how would they go from studying the Masters of Public Health into that career?
Yeah, so aged care very much so related to public health across the breadth of everything public health does, from policy to epidemiology to health promotion to policy development. All of that can be applied within the aged care sector. I think we've seen in the last year how important it is in the aged care sector, and perhaps moving away from private models or even having private models that engage in public health. and bringing the health aspect and positive well-being into the aged care sector is going to be really important. And I think that will be a really growing area of research and endeavour. In terms of childcare, there is very much from public health units. They do a lot of work with early childcare and child providers in terms of immunisation research and prevention of infectious diseases among children, as well as promoting healthy behaviours and nutrition. So there's lots of areas in which, if you've got a particular interest in those two opposing ends of life course, that very much there's public health scope.
Yeah, absolutely. And I think from my perspective, as I said, I work in the public health unit. So we've got immunisation teams going out to schools and preschools, doing vaccinations. We've got flu teams doing investigations with aged care centres. We've got immunisation education for small children. But then I guess from the health promotion perspective, I work with adults. We've got a team who works with older adults, and we've got a team called the Healthy Children's Initiative. So we kind of cover across all the demographics. So there's, in health promotion specifically, there's programs which run in preschools. So you've got like the Munch and Move program, for example, which is getting kids to eat healthy foods. In the aged care end, you've got programs like the Stepping On program and Healthy Aging, which is helping to reduce falls in older adults and getting them mobile and getting them connected. So I guess from a health promotion perspective, we definitely work with specific demographics. That's, I guess, one of the parts like Western Sydney is identified particularly that we need to work in. But from a public health perspective, as well as Janaki mentioned, there's so many areas which have a specific focus on aged care and childcare.
Mm-hmm. Great to hear. And it looks like that we are running out of time. So just before we wrap up, I'll give it to both of you to say one final thing of your favourite aspect of the Macquarie MPH and what students need to be taking away from this webinar. So maybe you first, Janaki.
I think Ashlee is possibly one of the best things to take away from this webinar. I think she's a clear mascot for us, which we love, and an exemplar of what can happen coming out of a Master of Public Health course, to be embedded in a workplace that it lives and breathes public health and is highly engaged and effective and can be part of changing the world in terms of your small community and then how that impacts on wider society. So I hope you feel coming out of this that both Ashlee and I are very passionate about public health, and that the Master of Public Health at Macquarie can hopefully light some of that fire in you, and that you see it as a pathway to engaging in the world in a really positive way.
Yeah, I think the thing that I love about the MPH is that it is so broad. You can do anything with an MPH. And, you know, not just from a career perspective, but the MPH units and the electives that you can get involved in are so vast. If you have an interest area, you definitely will be able to look at it through the MPH, and that will build you the skills to have a great career. And so I hope I see some of you working for the World Health Organization one day, because definitely, yeah, the skills that you learn in the MPH, you can carry with you throughout your career. So yeah, I hope some people love public health. But yeah, it's such a rewarding career to know that, you know, we're making a small difference, but that small difference might just improve someone's life. So yeah, definitely look into it, and I encourage you all to join up.
Thank you for that. So just before we wrap up, just two quick announcements. So if we haven't answered any of your questions as we've just run out of time, you can always reach out to our future students team via booking a one-on-one consultation. Just throw that up. Yep. So if you would like to do that, they are always available. It's really easy to do, and it is available in the chat right now. Apart from that, thank you to both of our speakers for bringing us today a really interesting webinar. Next week on Wednesday, the 30th of September at 6 or 7, if you are really interested in hearing another perspective, we also have an industry speaker, Dr. Kate Kennett coming, also from the Western Sydney LHD. And it won't be a repeat of this webinar, but it will provide a different perspective on public health. So if you are interested in that, keep your eyes peeled for that. And if there's no other comments or questions, have a good night.